A very green greetings to all the people who are watching this podcast with us. So today we have Mrs. Sudha from Apollo Hospitals CSR. And like we go in every podcast, we'll be having a 30-second superhero introduction of me. Post that, we'll be having a superhero 30-second introduction of Sudha ma'am. So my name is Shrey Saxena. I'm a second generation social entrepreneur at Grow Diesel. At Grow Diesel, we are fighting climate change by converting waste into biofuel. And we also have a flagship project by the name of Hospital on Wheels, through which we have impacted more than 2.5 lakh people in the past 2 years during COVID. So this was my superhero introduction, ma'am. Coming to you, tell us who Mrs. Sudha is.
Yeah, I am a CSR professional, but from 5, 6 years, I am a CSR professional, but not at the beginning. I was not a I was a corporate person. So I joined a CSR, like it, you can say that 5, 7 years I'm into CSR, and like I have a 30 plus years of experience in the corporate world. So CSR is like I over a period of time, my corporate journey and all that, I thought I have lots of passion about CSR work, to help people, do lots of work, support. Like in office also, I used to do that. So, so I started like that as a volunteer. But it was I was doing my corporate work also, and side by side I was doing the CSR also as a volunteer. And volunteer, I used to spend my weekends, because it's a 5 day week in a corporate, and I was using my weekends like Saturdays and Sunday to do my CSR job. So I used to go with my directors and all that to see the places where you want to do the work, which area to where find the our people where for whom we can work. And this like best part is since beginning I was in this healthcare, and healthcare there's lots of needs for the people, lots of it, still there's lot of needs of people. If still healthcare is not reach out to every person in that remote areas, you can see in the cities, you can see lots of clinics and all, but it's not there. So preventive healthcare is still a huge requirement. So being in the healthcare, like I thought, start doing this volunteer activity, visiting the people, meeting up the people, and started this. Then it's like 2000, you can say 10. I started slowly as a volunteer. Then 2, 3 over a period of 2, 3 times, I've taken a full time CSR job. When my boss got retired, I said better to take up CSR because this is my passion, and it's like it's give me full satisfaction, job satisfaction. And at the end, when you go home, you feel like yeah, you have done something good for the society. So not a monotonous job. This do
Mhm.
this like regular work. It's like
Correct.
you have to go out of the way, meet up with the people, listen to their problems, then give the solution to it. So it's give lots of satisfaction. So then I was before that I was in Fortis Healthcare. So I did 5, 6 years of that CSR work there. Then I've introduced around 7 charitable clinics
Wow.
in
Seven
five
charitable
states in
clinics.
5 states. And we have impacted lots of people, and we were providing medicines, everything to them. And for these clinics, the people were very happy. There's those who can't go, they in Haridwar, there's lots of requirement is there, there's no proper healthcare setup is there. Then Haridwar, Udaipur, we went Delhi, we have opened 2 clinics. Then in Punjab we have started in that Golden Temple area. This we started this clinic. So
Oh, that's
like
amazing.
it was so off. And then apart from that, we used to do a community camps. We reach out to the people in the rural areas where no one goes. That there is no in that rural area. Still, you can see that there is no hospital. If government hospital is there, there is no medicines are available in that area. So then we impacted. We have conducted in a year before COVID. We have in 1 year time we have reached out to almost 3 lakhs plus people
Wow.
from the community camps, and the clinic part is separate. There also we reach out to almost 1.5 lakh people through clinics, and through the community camp we reach out to 3 lakh plus people. We provided eyeglasses to them and all that. So this way my journey to CSR started, from corporate to, I've never thought of ki I will be going into the CSR social work
Mhm.
thing. So that journey started. Then the COVID came, and 2 years gone in the COVID. But during that, I thought ki what to do now. Now company was also, everyone was doing that, paying to the Prime Minister relief funds and all that. Then the basic, we can't do the community camps. So lots of issues came.
Mhm.
Then it sorted out all. And then I got the opportunity to join Apollo during this COVID time only, because they were looking for some head operations who can take care of their one of the trust, Apollo Foundation. This Billion Hearts Beating Foundation. It's a trust of Apollo Hospitals,
Okay.
and it was founded in 2010. This was started as a campaign, heart campaign, and during that period, lots of surgeries done. So our chairman, Dr. Pratap C. Reddy, who is the founder of healthcare, private healthcare in India. He is known as a father of healthcare
Wow.
in India. He started this trust, and I got the opportunity to join this trust last year. And in this, we are doing 3 projects, and our projects are like, for Project Aushad we are doing, which is a very unique. No one is doing that. Like we are supporting 200 plus old age homes with
200 plus. Wow.
in 11 states with free monthly medicines. So
Oh, wow.
we are getting this, and this is being done since 2010. I joined in 2021, but it was started in 2010 only, and now we have added, from since I've joined, we have added almost 150 homes in. And
And in one old age home, how many people are there?
actually, our SOP is like that, minimum 10, maximum 50, 60. But
Okay.
we have ended also in many homes. So if you say how many beneficiaries in these 200 plus old age homes, so you can say 12,000 plus. So,
12,000 plus.
so
Wow.
every month, 12,000 plus beneficiaries are getting the senior residents, because our project is for only for the senior residents who is
Correct.
residing in these senior care homes. So they are getting free monthly medicines. Every month they send the prescription with the list of the resident, with the individual prescriptions and all. Our pharmacists, they compile that, and they send that medicines to them. So almost we are providing 90% of medicine free of cost. Which medicines are not available, it's other thing. Otherwise, we are providing almost all sort of medicines to them. And you can say that no organization or NGOs is doing this, because at the old age, medicine is very important part.
Correct.
And it's like it's because of lack of medicines, there's lots of few deaths were there in the old age homes. But since we have adopted these old age homes, there you can say that there's no death rate. And even during COVID, we have not stopped giving medicine to these homes. And because of that, we have reduced the mortality rate of these senior residents, because they are, everyone has their story, how they landed up here. Few are from very good family, but their children don't have time, they are settled abroad and all sort of people are there in these old age homes. So they are getting the medicine. Apart from that medicine, we are providing them healthcare amenities related to, we have given them even this all healthcare related, BP, sugar, you can say that, mattresses, bed, ration, everything we are providing. And whenever we get any donation, we distribute to these homes. So we
Wow.
don't keep any single penny with us. So we distribute
That's
everything
amazing.
to them. So this is what, and this one other project is Project Prashikshan. Or Project Aushad is our major
Mhm.
project. Then Project Prashikshan is, we are giving the frontline workers, institutions, and schools, colleges, institution, and that state police and the truck drivers and all BLS and first aid training programs. So we want to be want that we should train each and every people, because you can see after COVID, so much of cardiac arrest cases are coming, and
Mhm.
people don't know what to do, because someone faints but no one knows what to. If that 2 3 minutes is very crucial for a patient when anyone fainted due to the cardiac arrest. So it's very crucial, if there and then anyone who knows the CPR, they can give them the CPR, we can save a life,
Wow.
because it's very important. So we what this year we thought of that we will train each and every frontline workers, even state police and the traffic, or the NSS students, NCC cadets, and all the institutions where they want to learn. So we have almost you can say that we 15,000 plus we have already trained.
Wow. What was the name of this project, ma'am?
Project Prashikshan.
Prashikshan. Okay.
So, and the third project is Project Shuraksha.
Third is
So
Project
we have three
Suraksha.
projects, yes.
Okay.
Project Suraksha is less like a community camp. Like Project Raushad is only for the senior resident, but the Project Suraksha is a community. So
Mhm.
we are giving we are doing conducting health camps in the communities. We have done a tie-up with the transgender society community also.
Wow.
And during that, so they come, we have under this project, we are running two emergency care centers and two daycare centers. In Tirupati, there is one day 24/7 emergency care center is there. It's free of cost. So, and also in bus stand in Chennai, there's a 24/7 emergency care center. So we are giving free of cost. Whosoever comes to that, we save their life and send it to by ambulance wherever they want to go. We send them to that hospital. So there is no commercial angle to it. And second, there is a breastfeeding center also in that bus stand, because lots of women face difficulty. And because airport there is a breast center, but in bus stand there's nothing like that. So it's the largest bus stand, Chennai, Coimbatore,
Mhm.
where there we have a breastfeeding center and 24/7 emergency care center. And in
Wow.
Chennai, we have two daycare center that is also free of cost. So so we have done a tie-up with the transgender community. They come, everyone they come to this clinic, and anyone surrounding in that area, we have made a registration card. They come and they get them check, and they get the medicine, take the medicines, and then they get the food also. And this trans
Wow.
community, they come, they doctor give the prescription to us, then we provide them the medicines. So,
That's
and this and the community camps we are already doing. So lots of community camps. You can say that for 5 lakh plus uh, people we have benefited through these three and these things. And during COVID, we have set up almost 7 8 isolation wards, and we provided medical ICU equipments to the hospitals to set up these isolation ward centers. So this is a major what we are doing basically, and this is what
no,
is what
that's, I think
projects
you
we are
gave a
working.
quite a horizon about all the initiatives that you are doing. So what I understood, made notes. So you are running three projects: Project Oshida, Project Prashikshan,
Shiksha,
and Project
Suraksha.
Suraksha. Correct. And under that, you're targeting different angles and different problems that you have identified, and you have very beautifully and innovatively solved it. So I want to ask you one question based on the project that you mentioned. So what is the philosophy behind identifying a particular problem and then probably doing actions to solve them? Because if we talk about healthcare, specifically in India, we all know that how major of a challenge it is. Affordability is one aspect, then availability is the second aspect. So, being one of the leading healthcare institutions in the country and one of the premium institutions amongst the world, my question is that whenever you're talking about CSR and specifically CSR in healthcare, how do you identify that what is the most important problem and that is what you go have to go after? So how do you prioritize among all these buffet of
Actually,
problems?
we are into what our project is we are into preventive healthcare because now it's what we saw in the healthcare sector from so many years in the healthcare sector. We have seen that even the preventive healthcare, if you prevent a certain preventive healthcare is very important, and there are people those who are not even getting the preventive care, and if you get a preventive care, then you can reduce the disease there and then. If you are not getting things properly on time, then it comes over a period of time. It develops disease, grow, increase, and that it develops and then to into some other health issues. So then you need a curative, but still at the beginning. So our thing is that at least provide the basic, give the basic needs of the people, sort that out. Even so that's why we thought ki even we chosen the senior residents because
Hmm.
their health is because they are most vulnerable in that, because they are living in that area, they are very depressed because of their family issues and all that. Then and they are not getting a proper medication because its medicines are very costly. So we thought, why not? So this is when how this project Oshan came in force. I can tell you the story
Yeah.
behind it. So once one of our managing trustee, Mrs. Somda Kamneni, she is MD of Apollo Pharmacy also. She with her college friends, she there is a get together between them. So they met at one restaurant. So some one of the their friend, school friend, she's very old and they have and very not health wise she is very weak and can't even walk and all that. So there's lots of issues with her. So they somehow they managed to bring her to that get together, and that time when during the conversation they saw she said that if she was also staying in some old age home. So and she's no families and all that, so she was staying there, and she said ki if someone can help me because with the medicine, so this will be a very big support to me. So when they heard her story that she's facing so much of problem because of not getting a proper medication, she don't have a financial background, is also not so good and all that. This then there and then they decide, why not we adopt these old age homes and help them, because there are many other people those who are also facing this challenge because financially they are not, so no family member is supporting them, financially they are weak. Even the old age home can also they are giving space and food, that is enough. They also are dependent on the donations. If they are not getting a proper donation, buying a medicine also for them also it's a challenge. So
Correct.
they need someone who can give them this regular medication. So then this project started, Project Osha. It was Apollo Osha,
Wow.
and then we now we started saying that Project Osha. And this is not because it's you can say that because of CSR law came, CSR law came in force 2014, but much before that we have already started doing that, and not even the CSR fund. We are spending more than what is the CSR fund of Apollo Hospitals. So this is the I then there that idea came. Why not? If they started supporting her friend with this medicines and all. Then they said, why not we start doing help to these other old age homes also? They must be also facing the same kind of problems. So then slowly added few homes. And in Chennai we started. Maximum homes are in Chennai. You can around 65 homes we are supporting in Chennai.
Hmm.
Chennai in the sense Tamil Nadu area.
Okay.
So, maximum number of homes are in Tamil Nadu. Then slowly we added other states and other regions. Now we are in actually 200 plus homes we are supporting, and our plan is that by end of this year we will add more. Will reach add 300 plus homes. So this idea came from then when they saw us this suffering of their friend. And then they started this thought of it's a very important thing. Medicine is very important at this age, at older years. When you reach out at certain age, there's a medication is very important part, and we should support them. So then we started supporting. Then this project came in force and started slowly. We started.
Wow. And I think
So
I
our
would
main motto is that everyone should be live with dignity and respect, because they also need the dignity and respect. So our main motto is that live with the dignity and respect, and everyone should has a right of that.
I think you very beautifully told that particular story, that how a personal incident of MD ma'am, it came into picture, and how she felt responsible towards that friend, followed by a massive action where now she and her organization and people like you are taking care of roughly 12,000 old people who have no access to any kind of support. So I feel that is a very important problem that as an organization you are solving, and how beautifully you're doing it. It is very, very commendable. And I would actually like to tell it to the viewers who must be listening to this podcast. So the whole idea is that a lot of times when we as individuals face certain problem, and once we decide that okay, this is a problem and this is what something that we need to solve, and then we, if we think of solving it at a scale, that is where that impact starts to happen. And I think this is how this beautiful initiative project Oshad came into picture, and now it is such a massive part of their CSR activity. So I feel I'm I feel very happy after listening to this beautiful initiative that you have been running. Now, coming to another question, ma'am, and that is more related to you as a person. So you have talked a lot about your working and your professional life. Now I would like to know you a little more, and we would like to dive deep into your school or college life. So what do you think is that one story from your school or college life that inspired you, or you feel very proud of, that you experienced that particular thing? Would you like to share it with us?
Yeah, for regarding my school, my dad was in Indian Air Force. He's a
Wow.
retired from Indian Air Force. So we used to travel we have always been to all the states everywhere, because it's a transferable job. So I studied in central school. So and all most of the time is in cantonment area, and I saw my daughter. Even I can say that when I was 1 year old, we were at the Bengal border. During that time, India-Pakistan war was there, and we are at Bangladesh, the Bangla border, the Air Force station. So I just hear lots of story about my dad. He's on the border for fighting. Mom staying in the this cantonment area. How she was taking care of us, hiding us during that any bomb shelling is there, and hide in the trenches and all. This I saw a lot of this thing activities like, and this made me, and because of this background from the defense, and we have stayed in that area. I saw my dad like that. So lots of like I was also got these all the this thing from my dad, my mother, and all the courage and that this thing. So I also over a period of time I have when I was in college, I've done all in Delhi. I done my from Delhi University. I done my college and all. So I've joined NCC,
Oh,
National
wow.
Cadet Corps. So because I got the chance here, then I joined NCC. During that time, I wanted to join Indian this Air Force and Defense, but during my time, it was not allowed, not open for women's. Now it's women's can join Indian Air Force or Defense, any Air Force, Army, anywhere. But during my time, it was not there. Not only medical field you can go, but I I've joined NCC, and then I gained certificates. I went for the all the camps and all that. So that also given me lots of confidence. They gave me lots of confidence. You are in the Guard of Honor during 26th January. You are doing lots of physical activities and all. So this gave me lots of confidence, and doing the, I was earlier, otherwise I was a very shy person. I hesitant to talk. And during my school time, I was very small. I have to participate in my stage in that some show. So I didn't go. I was ready, but I didn't go to this stage. I was so afraid of that. So over a period of time, I changed myself. Now I can talk. I'm confident. Like then this all these things comes because of my the my journey of my like then after this thing school college I have joined my first job was in that, so I've joined as in that airport, international airport. I worked there for 6 months, but I didn't like the job. It's like quite hectic, 12 hours. So, then I joined. I worked in finance company. I worked there 10 years. Then after that, I got job in Fortis. When I joined healthcare, so I think this is the where I should be. Like it's such a like you are helping so many people. People are calling you. I was working with the top management and CEO of the company, and everyone used to call me day, night, anytime. Like I need this help. I need that help. Some patient is admitted, some accident happened, they don't get, they are not getting the beds. So somehow this everything came into that. I've started helping people, and this over a period of time, this but as my, if you say as per my my personal things, I am a painter. I do
Oh, wow.
canvas paintings. I have learned my this dress designing. So I've never wasted my time. I know embroidery, dress designing, everything. I'm a painter. During COVID time, I've done lots of paintings, canvas paintings. I've not wasted my time. I've
Mhm.
joined lots of mentors. They also gave me lots of ideas in how to see how to set your goals and all that. So I've learned from different people. My previous company, my boss was there. He's a very good leader of healthcare. I've learned from him a lot. He used to guide what to do, how to do that, how to make this all slowly. I got all these things in my person thing, so that my passion, or you can say my nature and all this all came together, and I came into the CSR. I've started CSR now, and wherever I go, so everyone appreciate that. Yeah, we need person like you in
Ma'am,
CSR.
quite a journey it has been. Like you mentioned that you come from an army background, and then how you were always going to places, and then you joining the NCC, post that coming into CSR. I think you have had quite a beautiful journey. You have lived a very beautiful life, and now you are at a stage where you are impacting thousands and thousands of people. Now, which brings me to the next question, ma'am. Who is that one person, or you can name more than one people, whom you are really thankful to, except your family members? They should be non-family members to whom you really respect and you're very thankful to.
So I am very thankful to Mr. Rajiv Dua. He is senior vice president in Fortis Healthcare, who is the one who brought me to the CSR. He only said, "We have. Will you be joining us as a volunteer for this CSR activity?" And from there, I said, "Yeah, now I am in the right path, right." So he has given me a path to where I could go a longer way, and apart from that, I'm getting lots of appreciation. People know me better than what I can do. If in the simple corporate job you are doing a regular activity, and
Hmm.
everyone is doing the work, and there's no thing, no one is recognizing you as a person, and when you are going out, how. So this is the path was given me by Mr. Rajiv Dua. He's a senior vice president in Fortis Healthcare. So I'm very thankful to him and support. And apart from him, my boss Daljit Singh, he was a president and the ex CEO of Fortis. He gave me, he also always supported me. He never told me, no, do this work, you can't go out. Whenever I asked for time, I want to go for this activity, so he never said no. He said, okay, good, you are doing. And till now also, whenever I send him any message, I got this. Okay, I just tell you, in 2019, I got a National Prerna Doot Award from Ministry of Enforcement
Oh,
and Social Justice for the CSR, the clinics,
wow.
charitable clinics I got. So, and now recently this in December we got Times Awards, ninth CSR Times Award for Project OSHA.
Okay.
Gold category, gold category
Congratulations.
award we got in healthcare for CSR this month only, December. So, so whenever I send them the mail, I did that. So I always got a message back from both of them. I'm proud of you. Like it's felt so good. Like they are saying that I'm proud of you. So whenever I send Mr.
Very nice.
Dua or Mr. Daljit Singh, or me, a few more people are there. Though although those always guided me, what I am doing, how I am doing, and so they always reply back, "I'm proud of you." So it's like this makes me so felt. You feel so good, like yeah, I'm doing the right thing or right work. I'm into right place,
You're at
basically.
the right place. And in
Yes.
fact, I think that that feeling must be priceless, because once you get that internally, that yes, I've got I'm doing something really meaningful, that work is impacting life. I'm connected to people who believe in me. So I feel that kind of feeling in itself is what everyone craves for, and deep down everyone just wants that feeling. So I just see that in your aura, that you are very full of life, you are full of joy, and you're very happy and very proud of what you're doing. And I think we really need people like you in the system, who can just get the tires rolling, and people at the bottom of the pyramid, they are receiving the necessity requirements that they must be getting. Which brings me to the next question, ma'am. uh, do you work with student volunteers? So let's say, like you told that you started your journey as a volunteer and you transitioned into a full-fledged CSR professional. So does your organization has any opportunities for students, if they want to work with your organization, how they can get associated? Is there any selection process or something of that sort?
Actually, we have not taken any volunteers as of now. Uh, so I don't feel like like we have in hospital, we have MSW students, social workers are also there, but
Mm-hmm.
it's a hospital does that activity, that interns and all that. It doesn't come under me. So in my this thing, if anyone wants to join in for these activities, they are very much welcome to join, because
Okay.
this is what we are doing. Actually, ours is a very systematic work. So what volunteers will go whenever we are doing a health camp, they can go. So what we have recently started a weekend warrior program.
Weekend
Weekend
warrior.
warrior program.
Okay.
So weekend warrior program is about one people can join us as a volunteer, and they have to sign certain formalities, and whenever we are doing any activity with the old age people, they can join us during, we will give them the information and they can come and join and help. So in that, this weekend warrior is to spend a quality time with senior people, and it's and do the activities, they help them in the daily activities, serve them the food, make the food, give spend some time with them, play with them, organize some games with them. So like one day weekend, you spend at least till lunchtime, spend some time with the senior people, and then that is program is there where volunteers can join, and they can go with our team members. We have a certain format for it. They can we can take them. So if anyone is interested, anyone
Wow.
wants to give their services for this, we will be very happy to.
Definitely, ma'am, and I think that is pretty valuable for all the students who might be looking out to volunteer. And I think the section of people that you have targeted, the beneficiaries, and I think that is pretty commendable, because they also feel that okay, there are people who are coming, they are spending quality time, and so that it may not fill the whole void that they must have been through because of their families. But yeah, I think to some extent the void must be filling when people are coming and meeting them and spending quality time. That's really nice, man. One question that I'm really curious about. since you are already a healthcare professional, now how has CSR landscape changed post COVID? Like what, how the CSR was going before COVID and how it has changed post COVID? What are your views on that?
Post, I don't see much change because for us there is no for healthcare is during COVID also healthcare is we are working. So for us there is no COVID all the time. You are working. We are providing medicines regularly. We are though we have created a bubble for this old age home so that you can't go direct in contact with these people during that time, COVID times, but we are providing all the medication to them. So for us, there is no holidays, nothing. I even, if you say about my personal thing, that I am a healthcare administrator and a assessor also, national NABH assessor, this National Accreditation Board of Healthcare. So for us, I worked in the emergency administrator as also in the hospital during COVID times. For healthcare, there's for COVID and now it's little better because now we are able to go and meet up with these people. But I am very proud to say that during COVID times there is no single death in any old age homes we are supporting, and
Wow.
these homes the health got better of all the senior residents because after we adopt them we are committed for life with them, so we are always providing them the help support to them. So I don't. We now we are going and reaching to. So after before COVID, we Project Ashad is already in force. There is no before and after. It's the same process. The Project Prashikshan has we started after COVID. We tried doing online also, but somehow people doesn't like the online way because everyone wants to learn more when you do a physical. So now after COVID, now physical activity, physical training sessions started. And even Project Suraksha, if you say Project Suraksha community health camps, we are not able to do. Now we are doing lots of community health camps, but our clinics are always there. That our emergency care centers are always there, but because of all lockdowns and all, not many patients are coming to us. And this is what the change. But for us, it's like healthcare is working during
Absolutely.
COVID also.
Absolutely, ma'am.
Say the physical contact we have now we have increased more, which
Correct.
was we are not doing because we have to take care of our beneficiaries also. If we go and get in touch with them and they get some COVID or any this health issues because of us, so we don't wanted that.
Correct.
I think, ma'am, like you mentioned about certain
Certain of the health.
initiatives that you've been doing, it's really, really nice to know that. So I have one question following to what you said. So
Do you work with other NGO partners or you have your own set of people who are executing the projects? How do you work like?
Yeah, all the old age homes are also NGOs. This we signed the MOU with them.
Okay.
They are also NGO to whom we are supporting. So they are taking care of our other part of the senior resident. We are taking part of the medical part, medical thing. So we give them time to time medication awareness training program also being, so that how to give them the medicine, what is the right way of giving the medicines. So this is what
Okay.
we
All
are
right.
doing.
Okay. And let's say if
within the
three projects you mentioned, if
there's something that needs to be added, like you mentioned about community health
healthcare camps, something of that
sort. Now,
is there that you identify the projects and then you float an RFP and then probably the interested organizations are applying? Or maybe it's like some of your team members or including you come
Yes.
across certain good projects and you also implement them.
So
So how does
we have NGO partners and also we got the CSR fund as well. So
Mhm.
actually Apollo has lots of sister concerns and all. So they gave us the CSR fund for that, and we are then providing they as a project base we get the funds, and in that project we spend that. So we got for the project Suraksha we have done a tie-up with SBI Foundation and Citibank. They provided us for medical equipments and all. They
Oh,
supported
wow.
us. So and also we got some foreign currency from for some infrastructure FCRA fund also during
Mm-hmm.
COVID for support of this setting up this. So we are doing this. But if you say about that Apollo Pharmacy, Apollo Hospitals, they all are providing us the CSR fund to our trust. And
Okay.
also there are many other sister concerns, small companies. So we get this funds from majorly we get from our own sister concerns. And but we are very happy to tie up with other organizations as well. If anyone wants to join hand with us, we'll be very. So recently we have done lots of eye camps and all. So that for that we are tying up with these eye hospitals, different eye
Okay.
hospital in different regions. So of some part we are taking up, some part they are taking up. So we are doing the tie-ups with them as well.
Okay.
So
All
we had done the tie-ups.
Okay, that's really nice, ma'am. And in fact, and like you, when you must be selecting certain set of project. So, how are you evaluating the NGO partner? So, let's say that there's a NGO partner who is interested in collaborating with you. So, what are the evaluation parameters for that particular project?
So we'll see basically we'll see that their background, what they are doing, what certification they have, and what they have done in past and all that, and if they have what are their achievements after doing this activities and all. So
Mhm.
we'll go through all the documentations and all required for this activity. Then
Okay. All right. Which brings me to the rapid fire section, ma'am, before we finally wind this session up. So, rapid fire, you won't get any time to think and you just have to immediately answer whatever comes to your mind. Okay. Are we ready? Good to go?
mm,
Okay. Tea or coffee?
tea,
Books or documentaries?
documentaries,
Sunrise or sunset?
sunrise,
Money or power?
power and money.
One, just one.
Both is important.
Okay. Street smart or book smart?
Sorry,
Street smarts or book smarts?
book smarts.
Summer or winters?
I like winters,
Mountains or beaches?
mountains,
Would you like to travel in the past or future?
future.
Okay. How would you like strangers to remember you?
Mm, like actually, whenever I meet up with people, they like me with my smile and all those things. My what you
You,
say.
you indeed have a very beautiful smile, ma'am, and I can see a small dimple as well. That's
So
amazing,
whenever
ma'am.
I meet anyone, I just they feel like they know me from years.
Really, it wasn't feeling like that. We are interacting for the very first time. So you have that beautiful aura and a very friendly aura. Amazing, ma'am. So this brings us to the end of the Impact podcast with Mrs. Sudha, ma'am. And I think it has been a phenomenal 1 hour that we have spent together. And personally, I've got to learn so much. So much so that I'll definitely try to implement certain of my learnings in my life and in my institution. And I really hope that with this initiative, even if we are able to motivate just 5 people, the 5 students to work in the social development sector, I feel that it can create a big difference. Taking an example of Sudha ma'am herself, she started as a volunteer and now she's a full-fledged CSR professional. So I really feel that all the students who are out there just volunteers with the NGOs, you volunteer with organizations like Sudha ma'ams, and then you may realize that the kind of impact that you are creating as an individual, as a community, that is something that you would like to do for the rest of your life. And like my ma'am mentioned, that this particular work is not just about you're just going to a daily job, you're sitting, it is about impact creation. So I really thank you for joining this particular session, ma'am. And we'll be releasing this podcast very soon. And stay tuned with us.
Thank you.
So let
Thank
me
you.
just pause the recording and then we'll have a minor interaction.
Okay. Thank you so much. Thank